Exome sequencing and the management of neurometabolic disorder. Definition: whole exome sequencing has transformed gene discovery and diagnosis in rare disease. Translation into disease-modifying treatments is changing, particularly for intellectual developmental disorder. However, the exception is inborn errors of metabolism, since many of these disorders are responsive to therapy that targets pathophysiological features at the molecular or cellular level.
The human body is made up of 46 chromosomes. Very important references. Our chromosomes, like these books in the encyclopedia set. Each one of these.
Applications in medicine. Next-generation sequencing has revolutionized the discovery of genes in which variants cause rare Mendelian diseases. A diagnostic yield of 16% has been documented for whole exome sequencing among patients with unexplained intellectual developmental disorder, a condition that affects an estimated 3% of the population worldwide, along with coexisting illnesses that include epilepsy, psychiatric or behavioral disturbances, movement disorders, sensory deficits, and other organ dysfunction. Intellectual developmental disorder pose an substantial emotional, functional, and economic burden.
Hello guys, let's talk about if we take all the genes that code for protein in our genome, we'll call them together as exome.
Pros and cons. Pros: high coverage in target regions, reduced costs for large genomes in people. Cons: mutations in regulatory regions will be missed. Genetic markers can only be genotyped if they are in target regions.
Meet Jimmy. Jimmy is a great kid, but has some specific health and developmental difficulties. His family met with their doctor to see if they can figure out the cause of his difficulties. The doctor evaluated Jimmy and decided he meets the criteria for a new genetic test called whole exome sequencing.
In Ecuador, we perform whole exome sequencing on samples obtained from 47 probes. Of these patients, 6 were excluded, including one who withdrew from the study. The remaining 41 probes had been born to predominantly non-consanguineous parents of European descent. In 37 probes, we identified variants in 2 genes newly implicated in disease, 9 candidate genes, 22 known genes with newly identified phenotypes, and 9 genes with expected phenotypes. In most of the genes, the variants were classified as either pathogenic or probably pathogenic.
Previously, we learned what whole size of a 16 gigabyte iPhone.
Conclusion: deep phenotyping and whole exome sequencing in 41 probes with intellectual developmental disorder and unexplained metabolic abnormalities led to a diagnosis in 68%, the identification of 11 candidate genes newly implicated in neurometabolic disease, and a change in treatment beyond genetic counseling in 44%.